Welcome to the October Roundup of Coffee with Compliance. My name is Colleen Patterson, and I'm the Vice President of Employer Services and Compliance at Savoy. And joining me today is Sara Simkins, who is one of our Senior Compliance Specialists here at Savoy. As in months prior, Sara and I will be recapping all the happenings in the legislative and regulatory landscape over the course of the last month that are impacting employee benefits. So we've got a lot of stuff here that we're going to be covering. So I'm going to go ahead and get started. So the first topic that I have today is regarding a few updates for the New York Paid Family Leave Program. The program was launched back in 2018, and it was phased in over a 4-year period. It's hard to believe it's been that long already. As a reminder, New York State Paid Family Leave provides eligible employees with up to 12 weeks of job-protected paid time off. And that's to bond with a new child, care for a family member with a serious health condition, or to assist loved ones with a family member who's deployed abroad on active military service. This time can be taken all at once, or it can be in increments of full days. Now, the paid family leave may also be available in some situations when an employee or their minor dependent child is under an order of quarantine or isolation due to COVID-19. And in New York, that actually still applies. So fast forward now to 2023, the list of family members for whom eligible workers can take paid family leave to care for will include siblings with a serious health condition. So this includes biological siblings, adopted siblings, step siblings, and half siblings. So these family members can live outside of New York State and even outside of the country. Workers should check with their employer's paid family leave insurer to learn when sibling care will go into effect for their policy. And again, this is coming in 2023, so I wanted to mention it on our wrap-up call because as you're working through looking at plan documents and things of that nature, preparing for the 2023 plan year, this is an important component to be aware of. The next topic that I have is the Consolidated Appropriations Act of 2021, which made multiple sweeping changes to employee benefits. That's nothing new. Although the CAA may not have been intended as a health bill, it's really proven to be the most significant set of healthcare reforms since the ACA was passed. The most prominent of these CAA provisions for health plans is the No Surprises Act, which prevents surprise emergency, non-emergency, and air ambulance bills, as well as providing for temporary continuity of care rights for certain patients who lose access to network providers. Now, the CAA requires that employees and dependents participating in an employer-sponsored group health plan receive notice of their rights and protections against surprise medical bills. Now, the departments refer to this notice as the notice regarding patient protections against surprise billing. So that's important because we keep seeing terms like the No Surprises Act notice. Well, they're really talking about this notice as it relates to surprise billing. The CAA requires that employers post the surprise billing notice on a public website of the group health plan. Now, there's been a lot of talk about what constitutes a public group health, what constitutes a public website for these group health plans, and which group health plans actually have to comply. So let's take a moment and just talk a little bit about that. Employers with a public group health plan website, they should post this notice that's been newly released by the first day of the plan year beginning on or after January 1st, 2023. So if it's a calendar year plan, that means it's got to be posted by January 1st, 2023. And this is to ensure good faith compliance with this new CAA disclosure requirement. Now, here's the key about this whole public website thing and who has to do it. This largely is going to impact the self-insured plans. Employers without a public group health plan website for a self-insured group health plan, they should ensure that their TPA will address the disclosure of the surprise billing notice by posting the notice on the TPA's public website, where information is normally made available to, of course, the participants, beneficiaries, and enrollees on the plan's behalf. So as part of their vendor oversight process, the employers really should take steps to review their contractual terms, addressing the TPA's obligations to post this notice. as well as potential indemnification provisions from any TPA notice posting failures that could cause liability for the employer. So again, we're really talking largely about the self-funded employer. Now, for the fully insured world, this is something that is likely to be handled at the carrier level, so or the TPA, whoever it is that the fully insured employer is working with. So, but again, it is the employer's responsibility to ensure that whoever that third party is, whether it's fully insured or self-funded, they're to ensure that it is being completed. So moving right along, the next topic I have has to do with implications of higher 2023 benefits limits. So the IRS just recently released the final 2023 benefit limits, and that was confirmed in IRS Notice 2022-55. So these benefit limits, they reflect unusually large increases due to the highest inflation rates since indexing even began. Now, these final limits for 2023 are based on the 12-month change in the Consumer Price Index. As of September 30th, 2022, this average increased to 8.3% compared to last year, which was an increase of 5.3%. So it's a pretty significant change. Now, the reason I mention this is because it has an impact on the health and welfare side of ERISA. Now, the impact of these numbers is absolutely greater on the retirement plan side, where defined contribution programs are in place, but there is an impact to the health and welfare side, which is what all of us do on a daily basis. So it's important to note because the significant increase in the limits can have an impact on whether or not a plan passes non-discrimination testing, particularly when it's testing for the cafeteria plan. Now, a question that Sara and I and our compliance team gets all the time is, well, do I have to do discrimination testing for my cafeteria plan? And the answer to that is absolutely. So that's the first step. But now that you know that these limits have increased, you have to make sure that with these changes, your cafeteria plan is going to be passing that testing. So as a reminder, the Internal Revenue Service, or of course the IRS, they have various rules in place to ensure that health plans do not discriminate in favor of highly compensated individuals, highly compensated employees, or key employees with respect to plan eligibility, of course, pre-tax contributions, and even benefits. So to that end, health plans must undergo non-discrimination testing each year to determine if a plan is discriminatory. Now, remember, the health plans that are in place, that's really what determines what type of test must be completed. So for instance, the cafeteria plan may include the HSA, and the limits were increased pretty significantly for the HSA. And it could certainly include other component benefits in the cafeteria plan if these contributions are provided under that cafeteria plan. So for plans that require coverage or non-discrimination testing, the increased benefit limits, they could actually change the testing results. So it's important to ensure that with these new limits that everyone is truly conducting their non-discrimination test annually. And you want to do that sooner than later, because if you have to make a change to the plan, you want to do that now, or you want to do that sooner in the plan year than later. It's a lot harder to do it when you find that you're failing the non-discrimination testing and the plan year is almost over. So remember, failure to pass non-discrimination testing will result in all or a portion of the benefits being provided to those highly comped individuals or highly comped employees, and those key individuals being categorized as taxable. So the benefits provided to these individuals may need to be included in their gross income. If the employer already issued their W-2, then that means that they have to amend the W-2 in order to report the taxable amounts, and that can be very costly. As also one final reminder as it relates to this non-discrimination testing, testing failure does not have an impact or effect on non-highly compensated employees in any way. And with that, that wraps it up for me this month. Sara, what do you have for us?
So, quite a lot going on this month. First, I want to talk about the Affordable Care Act premium tax credits. So, in 2021, the American Rescue Plan Act expanded access to subsidized market healthcare coverage by eliminating the restriction in place that limited eligibility for subsidized coverage to plan participants who earned 400% or less of the federal poverty level, and lowering the cost of the marketplace coverage so that the premiums could not exceed 8.5% of the participant's household income. Both provisions were due to expire in 2022, but the Inflation Reduction Act has extended them for 3 additional years. So that's through December 31st of 2025. The extension does not require any action from employers. The employer mandate remains the same as and an employer penalty is not assessed unless the cost to the employee for single coverage is more than 9.12% in 2023, 9.61% in 2022. But group health plan sponsors may find more of their employees are seeking coverage on the exchange in order to take advantage of these subsidies. So this is something employers should be aware of. And related to that, the family glitch final rules were finally released. So it's important to note that these don't require any employer action or any changes to the employer affordability calculations. So when an employer looks at these and they say, what do I have to do? The answer really is just be aware of them. So for those of you who aren't familiar with the family glitch, when the ACA was originally drafted, plan affordability was based on the single employee enrollment tier for the lowest cost plan, and this is still the case. Of course, this created an unintended consequence where families would not be able to receive a subsidy on the exchange because it appeared as if there was an affordable plan offered to the entire family, when in reality, the affordable plan was only offered to the employee, and affordability isn't based on whatever the family has to pay for that coverage. So this new family glitch rule allows the employee's family members to get a subsidy even if the employee has an affordable plan offered to them. So a good thing to remember is that it's still only the obligation of the employer to offer an affordable plan to the employee only. So these rules are effective January 1st of 2023. And while we're on the topic of reporting, draft 1094 and 1095 instructions were recently released, so you can go ahead and check them out. Also effective on January 1st of 2023, there's a new qualifying event under Section 125 of the law, which of course means plans which use pre-tax deductions to pay for benefits. So now, individuals who are enrolled in family coverage, or really any coverage other than self-only coverage, may prospectively change their election to remove a dependent under the plan if that dependent is eligible for a special enrollment in a qualified health plan through the exchange. So you can see how this is a little bit related to those family glitch rules. Employers have to adopt an amendment allowing this change on or before the last day of the plan year the election changes are allowed. And that is, of course, if they are allowing this change. It's not something employers are required to do, it's something they are allowed to do. So again, this is effective January 1st of 2023. Also, I want to mention the FSA limits have increased to $3,050 with a maximum carryover of $610. Also, transportation benefits have increased to a maximum of $300. The QSARA cap has increased to $5,850 for single coverage and $11,800 for family coverage. These amounts are listed in our HRA chart and our HRA, HSA, FSA charts, which were just published for 2023. So those can be found on the marketing tab on the Savoy website, so you can go ahead and check them out as well. And finally, some things to keep in mind coming up. Our upcoming Employer Services webinar on November 16th is on employer shared responsibility reporting. This is probably our most important webinar of the year, in my opinion. It certainly is our most popular webinar, so please tune in. We're going to answer all those questions you may have about employer reporting and how to do it and what it's for, and anything you might need to know about it. And finally, we are releasing an RxDC webinar on November 15th, so please tune in for that as well. We're going to cover all of the important RxDC rules that employers need to be aware of as the deadline of December 27th draws closer. So that's what I have for this month, Colleen.
Great. Thank you, Sarah. So that wraps it up for us for the month of October. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use all of the resources that are available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.